Min-jae watched the neurosurgeon's hands move across the teaching screen with mechanical precision, his voice flat as he cataloged the layers of the human brain. She sat in the back row of the hospital auditorium, her notebook open but blank. This was Dr. Kang Ji-hoon, the man who had made her first clinical rotation a living nightmare 3 months ago, dismissing her questions as time-wasting and her presence as inconvenient. Now he stood before 200 nursing students, and she wondered if he even remembered her face. "Nursing students," Ji-hoon said, his eyes scanning the crowd without really seeing anyone, "will never perform these procedures. But you should understand what you're assisting." The condescension hung in the air like smoke. Min-jae's pen pressed harder against the page. She'd spent 4 years fighting to get into this program, working night shifts at her aunt's convenience store to pay tuition while her mother recovered from the stroke that had bankrupted them. She hadn't survived all that to be talked down to by someone who'd probably never worried about anything more than which luxury car to drive to work. After the lecture, she gathered her things quickly, but a hand caught her elbow in the hallway. "You." Ji-hoon stood there, his white coat somehow pristine despite a 12-hour shift. "You were in my OR last semester. The one who questioned my instrument choice during the temporal lobe resection." "I was trying to learn," Min-jae said, pulling her arm back. "You were disrupting a delicate procedure with unnecessary commentary." His jaw was set, his eyes cold. Curiosity doesn't excuse poor judgment. She felt heat rise to her face. "Poor judgment? I noticed the angle was compromised. I was right. You were lucky." He stepped closer, and she caught the faint scent of antiseptic and something underneath, maybe pine. "Luck isn't competence. Remember that before you risk another patient's life with your opinions." He walked away before she could respond, leaving her standing in the fluorescent hallway with her hands shaking and her chest tight with rage. Ji-hoon sat in his office that night staring at a CT scan without really seeing it. The nursing student's face kept interrupting his thoughts, the way her eyes had flashed when he'd challenged her. He'd been harsh. He knew that. But he'd learned early in his career that sentiment had no place in neurosurgery. One moment of distraction, one emotional response, and someone ended up paralyzed or dead. His phone buzzed. Another message from his father. "The board meeting is next week. Don't embarrass the family name." He closed his eyes. 34 years old and still living in his father's shadow, still trying to prove he'd earned his position through skill rather than the Kang family's hospital ownership and political connections. Every surgery, every decision, every interaction was scrutinized. Maybe that's why he'd been so hard on the student. She'd reminded him of himself before the weight of expectations had crushed most of the wonder out of medicine. Min-jae picked up extra shifts in the ICU, partly for the money, partly to avoid another encounter with Dr. Kang. But the hospital was only so big. 2 weeks after the lecture, she found herself assigned to post-op care for his patients. The first was an elderly man who'd had an aneurysm clipped, now 3 days out and struggling with memory issues. Min-jae sat with him during her lunch break, helping him piece together fragments of his daughter's visit that morning. When she looked up, Ji-hoon was standing in the doorway, watching. "His cognitive function should improve within the week," he said stiffly. "You don't need to spend your break here." "Mr. Song is scared," Min-jae replied, not standing. "He thinks he's losing himself. He's recovering from a complex neurological procedure. Temporary confusion is expected." "But he doesn't know that." "Not really. Not in a way that makes him less afraid." She met Ji-hoon's eyes. "You tell him the medical facts. Someone needs to help him feel them." Ji-hoon opened his mouth, then closed it. For a moment, something shifted in his expression, something almost vulnerable. Then it was gone. "Just don't interfere with the treatment plan." He left, and Min-jae returned to Mr. Song, but she couldn't shake the feeling that she'd seen past Ji-hoon's armor, just for a second. The pattern repeated. Ji-hoon would make his rounds, clinical and efficient. Min-jae would follow behind, slower, sitting with patients, translating his medical jargon into comfort. They developed an unspoken rhythm, never acknowledging each other directly, but moving around each other like planets in orbit. One night, Min-jae found Ji-hoon in the ICU at 2 a.m, standing beside a teenage girl who'd come in after a car accident. The surgery had gone well, but she hadn't woken up yet. Dr. Kang? Min Jae's voice was soft. He didn't turn. I operated for 9 hours. Everything was perfect. But she's still not responding. Min Jae stepped beside him, looking at the girl's face, so young and still. Sometimes they need time. Time isn't always enough. His voice cracked, barely perceptible. Sometimes we do everything right and still lose. She saw it then, the exhaustion, the fear he carried behind the cold professionalism. You care, she said quietly. You pretend you don't. But you care so much it terrifies you. Ji-hoon finally looked at her, his eyes red-rimmed. Caring doesn't save people. Skill does. Both do, Min Jae said. You taught me that, even if you didn't mean to. They stood in silence, and slowly, without discussion, Min Jae pulled a chair beside the bed and sat. Ji-hoon hesitated, then did the same. They stayed there until the morning shift arrived, not talking, just present, 2 people holding vigil in the fluorescent night. The girl woke up 3 days later. After that, something changed. Ji-hoon still didn't smile much, still maintained his distance, but occasionally he'd pause during rounds to explain a detail he thought Min Jae would find interesting. She'd catch him watching her with patience, his expression unreadable but not hostile. They started having coffee in the hospital cafeteria during the dead hours, these strange, liminal conversations where they both pretended it was accidental. He told her about the pressure of his family name, how he'd chosen neurosurgery partly to prove himself, and partly because brains didn't care about politics or money. She told him about her mother, about the fear that she'd chosen nursing not out of passion, but desperation, and how she was slowly learning it was both, and that was okay. You were right that day, Ji-hoon admitted one night, staring into his terrible hospital coffee. During the temporal lobe resection, the angle was compromised. I corrected it after you left. Min Jae went still. Why did you yell at me? Because you saw something I'd missed, and I couldn't afford to admit fallibility in front of the surgical team. He looked up, meeting her eyes. Because I was more concerned with appearing perfect than being honest. I'm sorry. It was the first time she'd heard him apologize to anyone. I thought you hated me, Min Jae said softly. I thought you were reckless. Ji-hoon's voice was quiet. But you're not. You're brave. And I've spent so long being careful that I forgot what that looked like. The cafeteria was empty except for them, the fluorescent lights humming overhead. Min Jae felt something shift in her chest, a recognition that terrified and thrilled her in equal measure. Dr. Kang, Ji-hoon, he interrupted. When it's just us, please. Ji-hoon, she tried, and his name tasted different in her mouth, intimate. I think I've been wrong about you too. He smiled then, really smiled, and she understood with sudden clarity that this man who'd seemed so cold was actually someone who felt everything so intensely he'd had to build walls just to function. They tried to keep it professional. They failed spectacularly. It started with longer coffee breaks, then texts about patients that became texts about everything else. Ji-hoon would leave medical journals with notes in the margins on Min Jae's locker. She'd bring him proper food when he forgot to eat during long surgeries. Their colleagues started noticing, whispers following them through the halls. This is complicated, Min Jae said one evening, sitting in Ji-hoon's office after her shift. You're an attending. I'm a student. I know. Ji-hoon looked at her from across his desk, the space between them feeling both infinite and negligible. We should stop. We should, Min Jae agreed. Neither of them moved. If this gets out, Ji-hoon continued, his voice strained, it could affect your career. People will say you're using me for advantage. My father's position on the board makes it worse. They'll destroy your reputation. Min Jae's throat tightened. She'd worked too hard to risk everything now. But when she looked at Ji-hoon, at the way his carefully constructed walls had crumbled just for her, she couldn't imagine walking away. What if we wait, she suggested, until I graduate, 3 more months. Ji-hoon stood, moving around the desk. He stopped in front of her, close enough that she could feel the heat of him. 3 months, he repeated, like he was testing the weight of the words. We can be friends until then, Min Jae said, knowing it was a lie even as she spoke. Professional. Professional, Ji-hoon echoed. His hand lifted, hesitated, then gently tucked a strand of hair behind her ear. The touch was electric. Min-jae, I don't know if I can... The office door opened. They sprang apart as Dr. Yoon, the chief of surgery, walked in. Ji-hoon, I need you to... Dr. Yoon stopped, his eyes moving between them. Am I interrupting? No, Ji-hoon said quickly, his face carefully blank. Miss Park was just leaving. Min-jae grabbed her bag and fled, her heart pounding. Behind her, she heard Dr. Yoon's voice. Be careful. Ji-hoon, you know how people talk. The next day, Ji-hoon avoided her completely. He switched his teaching rounds to a different floor, communicated through other nurses, disappeared during the times they usually crossed paths. Min-jae told herself it was for the best, that they needed distance. But it felt like grief. A week passed. Then another. Min-jae buried herself in studying, preparing for her final exams. She told herself she was angry at Ji-hoon for being a coward, but mostly she was angry at the world for making something that felt so right, so impossible. She was leaving the library late one night when she found him waiting by her car. I'm sorry, Ji-hoon said immediately. I panicked. I thought if I stayed away, it would protect you. Protect me from what? Being happy? Min-jae's voice was sharper than she intended. From me. From the gossip, the judgment, everything that comes with being involved with someone like me. He stepped closer, his eyes intense in the parking lot's harsh light. Min-jae, my father is already investigating why I've been distracted. If he finds out about us before you graduate, he'll have you removed from the program. He's done it before to protect the family image. The words hit her like ice water. He can do that? He owns 40% of the hospital board. Ji-hoon's voice was bitter. He can do almost anything. Min-jae felt tears prick her eyes. So what are we supposed to do? Wait. Ji-hoon's hand found hers in the dark. 3 months. Graduate, get your license, and then no one can touch you. I know it's not fair, but... Nothing about this is fair, Min-jae interrupted. But I'm not giving up. On nursing, or on you. Ji-hoon pulled her close then, his forehead resting against hers. They stood like that, breathing each other in, not kissing, just existing in the same space. It felt like both a promise and a goodbye. The 3 months were torture. They maintained strict professionalism, communicating only when necessary, avoiding being alone together. Min-jae threw herself into her studies. Ji-hoon worked longer hours, performing surgery after surgery like he was running from something. But sometimes their eyes would meet across a hospital corridor, and the intensity of that look was enough to sustain her through the loneliness. Min-jae's finals arrived. She barely slept for a week, reviewing everything, double-checking every protocol. On the last day, she walked out of her practical exam exhausted and exhilarated. One of the evaluators, Dr. Yoon, stopped her in the hallway. Miss Park, a moment. Min-jae's stomach dropped. Had someone reported her relationship with Ji-hoon? Had it affected her scores? But Dr. Yoon was smiling. I want to offer you a position in our neurosurgical ICU unit, starting next month if you're interested. Min-jae couldn't breathe. Really? Your clinical skills are exceptional, but more than that, you understand how to connect with patients on a human level. That's rare. Dr. Yoon's eyes were kind. Dr. Kang submitted a recommendation for you, a glowing one. I suspect he didn't tell you. Min-jae felt tears threatening. He didn't. Think about it. No pressure. But you belong in neurosurgery. Dr. Yoon patted her shoulder and walked away. She found Ji-hoon in his office an hour later, finishing paperwork. He looked up as she entered, and his face transformed. I passed, Min-jae said. I know, I pulled strings to see your scores early. Ji-hoon stood, moving toward her but stopping short, still careful. Congratulations. Dr. Yoon offered me a position, in your unit. I recommended you, you earned it. Ji-hoon's voice was soft. Min-jae, I know we said 3 months, but now that you've graduated, if you don't want to pursue this, I'll understand. I've put you through enough stress. Min-jae closed the distance between them. Are you seriously trying to give me an out right now? I'm trying to give you a choice, without pressure. She kissed him. Finally, after months of waiting and wanting and pretending. His arms came around her immediately, pulling her close, and the kiss deepened, 3 months of restraint pouring into this single moment. When they broke apart, both breathing hard, Ji-hoon cupped her face in his hands. "I love you," he said, like he'd been holding the words captive. "I've loved you since you sat with Mr. Song and showed me that medicine is more than technique. I love your stubbornness and your compassion and the way you challenge me to be better." "I love you too," Min-jae whispered, "even when you're impossible and distant and too proud to ask for help." Especially then. They went public slowly, carefully, first telling close colleagues, then making it officially known to HR. There were whispers, some judgment, but most people had suspected anyway. Ji-hoon's father was furious, demanding a meeting. Min-jae sat beside Ji-hoon in the hospital conference room, facing his father across a glossy table. Chairman Kang was exactly as she'd imagined. Cold, controlled, radiating disapproval. "This relationship is inappropriate," Chairman Kang said without preamble. "It reflects poorly on our family and on this institution." "Min-jae graduated with the highest marks in her class," Ji-hoon replied, his voice steady. "She earned her position through merit, not through any relationship with me. The optics are that 2 medical professionals fell in love while maintaining complete ethical boundaries." Ji-hoon's hand found Min-jae's under the table. "I've spent my whole life trying to meet your standards, father, but I'm done sacrificing my happiness for the family image." Chairman Kang's eyes narrowed. "If you continue this relationship, I will withdraw my support. Your position here, your funding, everything." Min-jae felt Ji-hoon's hand tighten around hers. She knew what this meant to him, how hard he'd worked to prove himself. Her voice was clear when she spoke. "Then we'll work elsewhere. Together." Ji-hoon looked at her, surprise and gratitude in his eyes. He turned back to his father. "She's right. I love my work here, but I love her more. If you can't accept that, then I'll find somewhere that will." Chairman Kang stood abruptly, his face red. "You're making a mistake." "Maybe," Ji-hoon said quietly, "but it's my mistake to make." After his father left, Min-jae and Ji-hoon sat in silence. Finally, she squeezed his hand. "Are you okay?" "Terrified," he admitted, "but also free. For the first time in my life, I chose something for myself." "We'll figure it out," Min-jae promised, "together." Chairman Kang didn't withdraw his support in the end. Whether it was because Dr. Yoon intervened, or because he recognized his son's determination, or simply because he valued the hospital's reputation more than his pride, no one knew. But he stopped actively opposing the relationship, settling instead into cold disapproval. Min-jae started her position in the neurosurgical ICU. She was good at it. Better than good. Patients responded to her calm competence, and the surgical team quickly learned to trust her judgment. She and Ji-hoon worked together seamlessly, their personal and professional lives interweaving like sutures. 6 months later, during a rare quiet moment in the ICU, Ji-hoon found her charting at the nurses' station. "Break room. 5 minutes," he said quietly. Curious, Min-jae followed him. The break room was empty, and Ji-hoon closed the door behind them. He looked nervous, his hands shoved in his white coat pockets. "I've been thinking," he started, "about what Dr. Yoon said when we first started working together, about balance, about how good medicine requires both skill and humanity." "Okay," Min-jae said, confused. "You make me better, not just as a doctor, but as a person." Ji-hoon pulled a small box from his pocket. "I know this is fast. I know we still have challenges ahead, but I don't want to wait anymore. I've spent too much of my life being careful, and I'm tired of it." Min-jae's breath caught. "Marry me," Ji-hoon said, opening the box to reveal a simple silver band. Not someday, not when things are perfect, but now, messy and complicated and real. She was crying before she realized it, nodding before she could speak. Yes, of course, yes." He slipped the ring on her finger. and she pulled him into a kiss that tasted like antiseptic and coffee and promise. When they broke apart, both laughing through tears, Min-jae rested her forehead against his. "Your father is going to hate this," she said. "Probably," Ji-hoon agreed. "But I stopped living for his approval. I'd rather live for us." They stood in the hospital break room, surrounded by the beeping monitors and fluorescent lights that had brought them together, and Min-jae thought about all the twisting paths that had led to this moment. The stroke that had changed her mother's life and set her on this course. The harsh words in an operating room, the late nights and careful distances. Every painful step had been necessary to bring them here. "Come on," Ji-hoon said, taking her hand. "We have rounds in 10 minutes. "Dr. Kang," Min-jae teased, "are you saying our engagement is less important than patient care?" "I'm saying," he replied, pulling her toward the door with a smile that still took her breath away, "that we get to do both, every day, together." They walked back into the ICU hand in hand, and Min-jae knew that whatever came next, whatever challenges or judgments or complications, they would face it the same way they'd faced everything else, with skill, with compassion, and with the courage to be vulnerable in a world that often demanded armor. The pulse between them had finally steadied into a rhythm they could both trust.